Hello there, my people. My name is Lee Davey. I'm not an alcoholic. I refuse to be anonymous. I am a son, a father, a husband, a lover, a leader, a master life coach. And I spend every moment of my day helping people to live a self-led life after alcohol. And we're going to continue the series, Why Do I Drink Alcohol, by having a little few minutes focusing on alcohol use disorder, or AUD, okay? Now, the description of AUD, taken from the National Institute on Alcohol Abuse and Alcoholism, is that alcohol use disorder is a medical condition characterized by an impaired ability to stop or control alcohol use despite adverse social, occupational, or health consequences, right? And AUD actually encompasses, or the description of alcohol use disorder, it encompasses forms of alcohol abuse, alcohol addiction, alcohol dependence, and alcoholism. Okay. And the people who think they know more than most on this subject believe that AUD is a brain disorder. So alcohol use disorder is a brain disorder. Okay. And you can be diagnosed with mild, moderate, or severe, okay, alcohol use disorder. All right. And this is really interesting because the healthcare professionals use criteria from the Diagnostic and Statistical Manual of Mental Disorders. All right. Now, that's a mouthful. It's called the DSM. And this manual is in its 5th edition. So it's known as the DSM-5, and therapists and coaches refer to this when working with people who have or they want to diagnose them to see if they fit into alcohol use disorder. And there is an assessment there to see whether a person has AUD at all and to determine the severity of it, okay, to see whether they have mild, moderate, or severe, okay. And I want to talk about this. This is the main thing I want to talk about because I think this is really super interesting. So what are the questions that they actually ask you in this assessment of whether or not you actually have AUD? Well, the first one is, have you had times when you ended up drinking more or longer than you intended? Okay. And you can answer these yourself. Mine is yes. Okay. I'm thinking now about when I used to drink. Okay. More than once wanted to cut down or stop drinking or tried to, but couldn't. No, that wasn't me, if I'm being honest. Spent a lot of time drinking or being sick or getting over the after effects. Yes, definitely. Wanted to drink so badly you couldn't think of anything else. No, I didn't fit into that criteria. Found that drinking or being sick from drinking often interfered with taking care of your home or your family or caused job troubles or school problems. Yes, very definitely for me. Number 6, continue to drink even though it was causing trouble with your family or friends. Yes. Given up or cut back on activities that were important or interesting to you or gave you pleasure in order to drink. Yes. More than once gotten into situations while after drinking that increase your chances of getting hurt, such as driving, swimming, using machinery, walking in a dangerous area, or having unprotected sex. Yes. Continue to drink even though it was making you feel depressed or anxious or adding to another health problem or after having had a memory blackout. Yes. Had to drink much more than you once did to get the effect you wanted, or found that your usual number of drinks had much less effect than before. Yes. And finally, found that when the effects of alcohol were wearing off, you had withdrawal symptoms such as trouble sleeping, shakiness, restlessness, nausea, sweating, a racing heart, or a seizure, or sense things that were not there. Yes. So the scoring criteria goes a little like this. So if you answered yes to 2 or 3 of those questions, then you will likely be diagnosed with alcohol use disorder and a mild case of it, or a mild version of it. If you answered 4 or 5 of those questions in the affirmative, then you have a moderate case. And if you answered 6+, then you have a severe case of alcohol use disorder. And do you know what? I scored a 9. Okay, I scored a 9. So I have a severe case, or I had a severe case of alcohol use disorder. And what does this mean? Well, I think that this means that something is off here. That either this scoring system that DSM uses to determine whether or not we have alcohol use disorder is inaccurate, or we have a really, really big problem within society. That means when we have a severe problem with alcohol use disorder, it actually doesn't even come up on a blip of the radar of the average Joe or Josephine, right? Because if you think about it, where I grew up, for example, and I know that this is not isolated to me because I've worked with so many people on this, that culturally society is actually drinking alcohol at a level that the DSM-5 categorizes as a severe brain disease. And most importantly, those who fall into this category, and I was one of them, have no idea that this is their likely diagnosis. And even contrary to that, they don't feel or they don't believe that they have alcohol use disorder. They don't believe that they have a brain disease. They actually believe that alcohol, the alcohol that they're consuming, is the most fun, right? Is the most fun or the most vital part or component of their life, okay? Now think about that. That is incredible. This is the reason why I was able to say, okay, no more. I am not drinking anymore. This is crazy. This is loopy. We cannot do this, Lee. There is something off here. And what is happening is the world at large is consuming so much of this stuff, so much of this drug, that they actually, a lot of people would fall into alcohol use disorder, a severe brain disease, and wouldn't even know that they have it and would think that everything they're doing is perfectly normal. So what's really going on? Tune in tomorrow to find out. Tomorrow, we're going to talk about my theories on alcoholism as an invisible, violent, and dominant belief system. And I will give you some of the answers as to what is going on with this alcohol use disorder diagnosis. Okay. All right. Thanks for tuning in. Much love, everybody, and strive on and take care. And let me know what you think about what I've spoken about today by dropping a note in the comments below. Much love.